So good morning. My name is Reva Farenback-Brateman. I'm one of the senior services social workers at Jewish Family and Children's Service in Southern New Jersey, which is we're based in Cherry Hill. I'm in my 18th year there. And currently I run a number of groups, including the one I will present on today. Richard Hinchman, my co-presenter. Yes.
Just joined.
Oh, there you are.
Hi. Sorry.
Richard, you just want to introduce yourself?
Sure. So I'm Richard Hinchman. Officially, I'm representing Aging with Pride, and also Garden State Equality's Elders for Equality initiative, which I'll talk more about in session 2. But I'm here today for Aging with Pride. And I'm a participant in Aging with Pride for the last 4 years, I believe. Okay.
So, this was the inspiration for the program. By the way, I am a cisgender woman. I am heterosexual, as I mentioned. I have a husband, my agency is a social services agency. We receive cultural competency training on a number of different topics every year. And we had a fabulous presentation on LGBTQ plus concerns and issues back in probably 2017. And it got me thinking, since I work exclusively with seniors, what must it be like for older LGBT adults? I don't know if you can see, I have some gray hair. I'm 71. And so, you know, I had friends back in the day who were gay, who many of them passed away during the AIDS crisis. But I had a couple who attended another program that I run. It's called Cafe Connection. It's a memory cafe. And if anybody's interested in that, please contact me. It's for people who are living with a dementia or a memory challenge, who come with a care partner once a month for an interactive program. And I had an older gay couple who they were openly gay, who were coming to that program in their late 80s. And I thought, my gosh, what must it be like for them? Did they have any support system? Obviously, they didn't have any parents left. Given their age, you know, did they have family support? Of course, in your late 80s, many of your friends have already passed away. And it just got me thinking. I went to my executive director and I said, I think we should run a program for older gay adults. I barely had it out of my mouth, and she was on board, which I'm very grateful to her for that. We did not do a needs assessment. Good social work practices, you do a needs assessment and then you set up a program. It just was like, why don't we try this? I did not know of any other gay clients in our agency. I assume there probably were some, but I didn't know them. So I did an internal query of our social workers, which turned up 2 additional people in addition to my initial couple. I did outreach interviews with known community contacts. We had a gay rabbi in our community who was instrumental in helping to set up our youth programs called Project Rainbow. And just some other people that people knew, and I just started talking to people. As I said to folks who were on earlier, We're right outside Philadelphia, which of course does have uh, a, a lot of services for LGBTQ kids and adults. Um, and so I went to the William Way Center in Philly and talked with them. Uh, they run a group called Mornings Out, which is a group for older men. And I spoke at that group. Um, the Cherry Hill Library uh, invited me to speak at a coffee and conversation program, which had been organized by their diversity librarian. And that's actually where I met Richard. It was so we actually got off the ground in April 2018, and I think that program was probably in June, a couple months later. So Richard has been involved for quite a long time, and I garnered a couple, 2 or 3 other members at that program. Again, you just sort of have to put yourself out there, and you know that that baseball movie, you know, if you build it, they will come. And that's really what has happened. Um, I did an email blast to over 180 community contacts. So these are people who serve seniors in our Tri-County area. I should say we basically serve Hampden, Burlington, and Gloucester counties in southern New Jersey. Um, although when I spoke to William Way Center, we now have, I don't know, I think it's 10 members from Philadelphia who come over the bridge as well. Um, we advertised in our Jewish community newspaper. It's called the Jewish Voice. You know, with flyers, we distributed them. So our very first meeting I held in the evening because other senior groups that I had run, some of them like to meet in the evening. Uh, and it was held in the Jewish Community Center where our office is located. And we had 6 men and 1 woman at that meeting. Um, so the man who was caring for his husband with dementia, and 2 of our clients and some other people by word of mouth. They quickly told me that my ideas for the program were not what they needed. I had thought we would do a 6-month series, meeting once a month. One time would be legal issues, one housing, one financial, healthcare, social, and this was not what people wanted. So they told me, no, we don't want to meet at night. We're in bed by 8:30. I'm not sure that's quite true, but uh, driving at night, as you know, for seniors is sometimes an issue. I had brought wonderful rich desserts. They said, oh no, we're watching our waistlines. Well, that was nonsense. I still give them refreshments and they eat them up. Um, and by the way, I think that's an important thing when you do programs because it helps people. It's an icebreaker in itself as people go up to get a cup of coffee and a sweet treat or something. You know, it's informal and they're chatting with one another, and then it gives them something to do with both their hands and their mouth if they're a little reticent to talk. Um, so what people really wanted was a community center that they could drop into. And unfortunately, that was not something that I could give to people. But what I said was that I could give them a place to meet once a month to offer a free program to them. Um, and we would we would take it from there. Originally, we thought it would be people 60 and older. Um, but then I had some people in their 50s who wanted to join. And I was like, okay. So we extended it down to 50. I don't go lower than that because the issues are different, the concerns are different. Uh, and the people who are in their 50s for the group, actually, many of them are still working. Um, so they sometimes can't make meetings. When we were on Zoom, it actually helped because, you know, they could, even if they were at work, they could sort of take at least part of the meeting for lunch. They decided that they did not want allies, that it would just be people who identified as LGBT. You might wonder why in this day and age I'm not using the Q. Again, I told you my age. Back in the day especially, queer was not only derogatory, but oftentimes dangerous. And I felt that it shouldn't be used. And it sort of follows what SAGE, a national organization for LGBT older adults, uses. So, in truth, many of our participants don't relate to that. The young people have uh, taken it back and made it their own. Hugh is, as Richard will say, he's doing a workshop in the next segment. Um, it's queer or questioning. But I have to tell you, we did a program, an intergenerational program, and um, the coordinator of our youth group wanted people to put their pronouns on, and many of my people just, what are you talking about? They just didn't relate to that. So the structure of the group is it's a daytime meeting held once a month. Originally, I was floating different days. I realized that was a problem. People now know it's the second Friday of the month. We meet in the afternoon from 1 to 2:30. The Jewish Community Center used to be a congregate meal site for older adults, so many of my people would come for lunch first, which was a good way for them to socialize informally. As I said, I provide light refreshments. The group is free. We have a sponsor whose annual contribution helps to offset some of my time and refreshments. Today, we have close to 90 individuals who have attended at least once. Since we've been going 4.5 years, a few have passed away or have health issues that have prohibited them from coming, or as I said, some of the working people. We have a core of over 40 people. We actually grew during the pandemic, not only with working people, but others, and it continues to grow. When we met this past Friday, we had 4 new participants. It grows through word of mouth. Just quickly, some of the issues and concerns. Many are comparable to what other older adults are facing: loneliness, isolation, feeling invisible, um, a lack of community, for many, declining income due to retirement or disability, exacerbated by discrimination that they might have felt all of their lives in the workplace. A number have faced the death of a spouse or life partner, and of course friends because of their age, their own declining health, and not having a support system, as most have not had children. Their family and friends, of course, may be dead or have ill health themselves. I want to give Richard the floor now so that he can talk about it from his perspective.
Thank you, Reva. So I came, as she mentioned, I came into the group a couple months into it in June of the first year. And my experience is that aging LGBT folks, and I use the Q word, but it's not popular in our age group, that we do experience unique experiences. And like Reva said, we're looking for a safe space, so we don't include allies because sometimes it deludes the experience. When I talk in the second session about the opposite of inclusion of LGBT in mainstream conversations, there's a different thing going on. But in this situation, these folks are looking for people who share the same experience. And for LGBT aging people, very often we feel like we're experiencing bias, prejudice from two directions. And one direction is the experience of the experience of LGBT discrimination, but the second level is we experience ageism, and ageism in the gay community, somewhat like the mainstream community, is very destructive and very disheartening. And if you, so the group has expressed very often that we feel like we, in some ways, the baby boom LGBT community built the LGBT community that we know now. The Stonewall experience is part of our lives, and we built this community, and then we start to feel